A story of three worms in the eye. Worms in the eye are not uncommon. They could vary from microfilaria to cysticerci. This is a slit lamp image of a subconjunctival worm which is alive and moving. This was in a 40-year-old lady who presented with a foreign body sensation in the eye. She couldn't appreciate the movements of the worm. Her complaints were quite non-specific. We were pleasantly surprised to see this coiled up structure in a subconjunctival space. This is another of my colleague's patients who was being treated for glaucoma, and we saw this worm wriggling away to glory in the anterior chamber. This patient underwent surgery under Helon, and we had to manually remove the lens, the worm, without touching the lens. And this worm was proven to be Wucheria bancrofti female adult worm, which is a type of a microfilaria. This is the third patient, who was a 60-year-old lady who also presented with a very non-specific complaint of pain, redness, a foreign body sensation. Even she couldn't appreciate any movement in the subconjunctival space, though I thought that that would be the presenting complaint in most of the patients. This case we operated on an emergency basis in the night itself, because we had learned from a previous experience that in case we delay the surgery in these patients, these worms tend to migrate into the orbit, and we might not see them the next day when we plan them for surgery. Though we were lucky enough, in most of the cases the worm comes back after a couple of days in the subconjunctival space to make their removal easy. After giving the block, the movement of the worm reduced to an extreme extent, and it was not as mobile as before, so maybe the xylocaine paralyzed the worm also. This was one of my first cases, and I was a little apprehensive about how it would go about. You could still see the movements of the worm under the microscope. There you can see a small nick in the conjunctiva, and something walks out. Yes. And I think we need to help him to come out. Yeah. He wants to go back, is it? Maybe I think we should get him out fast before he goes back somewhere else. It's very, very long. There's some more coming out. There, you see it's out. This was almost 2 meter long worm which we removed. We give a wash with betadine, and we remove some fibrinous material which was there in the subconjunctival space. And this is the worm, still alive, in normal saline, moving away under the microscope light. This worm was diagnosed to be of the Diphylaria species. It was the adult female worm. The conjunctiva is closed. The patient was extremely relieved to get rid of this worm and was very happy that we immediately operated her on the same day of presentation. You can see the worm, how coiled up it is. It's still showing some after movements. On high magnification, when we saw, we could see the alimentary canal through a translucent body of the worm. We send it to a parasitologist who gave us the diagnosis of Diophilaria. There you can see it's still alive and moving around. The worm managed to stay alive for almost a day in the normal saline. And that's on the high mag. You can see the alimentary canal through a translucent body wall. My colleague had the fortune of removing almost 3 worms in a week's time and from the subconjunctival space, and his worm was of the lower species. I saw a worm in the vitreous during my residency days at KM. The patient presented with a vitreous floater, and on indirect ophthalmoscope we could see the worm, which was again of the microfilaria species it looked like. On ultrasound B scan we could see the movements, but the patient was not willing for any intervention surgical because he was 6/6 N6. All these patients received a full medical course of anti-microfilarial treatment that included tablet hetrazan along with steroids. Ivermectin is another drug which could be tried out in these cases. This is showing you the photographs of the pre-op. On slit lamp. The eye was relatively quiet considering the size of the worm. This is the worm which is being held up. And that's the length. Most patients had negative blood test for microfilaria, and that is a happy surgeon doing good for his patients with that broad smile. So be careful when you see some patients coming to your OPD with a foreign body sensation. Look for worms. Thank you.